Good afternoon, folks. Today's we're discussing what to look for when it comes to declining cognitive health. So here we go with today's presentation for you that I may please enjoy. Refers to early warning signs and considerations that may indicate onset of cognitive decline, particularly in the context of conditions like Alzheimer's disease or other forms of dementia. Based on the surrounding page content from the Alzheimer's Association Connecticut chapter, here's what the discussion likely emphasizes. Key indicators of cognitive decline. Clara Gorder and Christine Costo highlight several subtle and often overlooked symptoms. Memory lapses that go beyond typical forgetfulness, e.g., forgetting names of close friends or recent events. Okay, give me 1 second, guys. Difficulty with familiar tasks, such as managing finances or following a recipe. Language problems, including trouble finding words or following conversations. Disorientation, time or place like getting lost in familiar settings. Poor judgment or decision making, especially in financial or social contexts. Mood or personality changes, such as increased anxiety, confusion, or withdrawal. Why these signs matter. The symptoms may appear vague or gradual, making them easy to dismiss. The Alzheimer's Association stresses the importance of early detection, which can lead to better care planning and access to support resources. Okay, community awareness, helping caregivers and loved ones recognize when professional evaluation is needed. Support networks, including local chapters that offer education and counseling and advocacy. If you're working on community-based interventions or caregiver toolkits, this kind of framing could be integrated into culturally responsive outreach or frailty-aware screening protocols. Would you like help adapting these indicators into participatory checklists or digital resource? Misconceptions about caregiving or misconceptions about cognitive decline can lead to stigma. Delayed diagnosis and missed opportunities for prevention or support. Here is a breakdown of the most common myths grounded in current research and clinical insights. Common misconceptions about cognitive decline. Dementia is a disease. Dementia is a syndrome, not a single disease. It describes a decline in cognitive function severe enough to interfere with daily life. Alzheimer's is the most common cause, but others include vascular dementia, Lewy body dementia, and frontotemporal lobe disorders. Too many, our memory loss is always the first sign, not necessarily early symptoms can include word finding difficulty, spatial disorientation, or changes in financial judgment. Some types of dementia begin with language or visual disturbances. Cognitive decline is not normally part of aging. Aging may affect processing speed or short-term memory, but significant cognitive decline is not inevitable. Many older adults maintain strong long-term memory and reasoning skills. Dementia is always genetic. Genetics play a role, but lifestyle factors like exercise, diet, and cardiovascular health can significantly reduce risk. Only rare forms of dementia are strongly inherited. All memory loss equals dementia. Occasionally, forgetfulness, like misplacing keys, is common and not necessarily pathological dementia or pathological. Dementia involves progressive and functionally impairing changes. Dementia cannot be prevented. While not all causes are preventable, up to 40% of dementia risk may be modifiable through healthy behaviors like managing blood pressure, staying mentally active, and avoiding smoking. Why these myths matter? They can delay early detection, which is crucial for care planning. They may discourage protective health behaviors that reduce risks. They often fuel stigma, making it harder for individuals and families to seek support. Would you like to co-create a myth-busting resource tailored for caregivers or culturally diverse communities? We could integrate this into your digital outreach or participatory toolkits. Preventing cognitive decline is a multi-dimensional effort that blends lifestyle, medical, and social strategies, drawing from leading sources, including Mayo Clinic, Harvard Health, and the Alzheimer's Drug Discovery Foundation. Here's a synthesis of the most effective evidence-based approaches. 6 core strategies to help prevent cognitive decline. Okay, we're going to go through those now, people. Be right with you. Strategy, why it matters. Practical actions. Manage vascular and metabolic health. Conditions like hypertension, diabetes, and high cholesterol are strongly linked to dementia risk. Keep blood pressure 130. Okay. Maintain HbA1c 7 if diabetic. Avoid tobacco and manage weight. 2. Stay physically active. Exercise boosts brain diverted neurotropic factor, or BDNF, improves blood flow and reduces inflammation. Aim for 150 minutes weekly of moderate activity, including walking, dancing, gardening. Prioritize sleep. Quality sleep consolidates memory and clears brain toxins. Poor sleep increases dementia risk. Okay. Address sleep apnea or insomnia. Eat a brain healthy diet. Diets like the Mediterranean reduce inflammation and support vascular health. Emphasize fruits, vegetables, whole grains, and fish, olive oil. Limit processed foods and added sugars. Engage socially. Isolation is a modifiable risk factor for cognitive decline. Fosters regular social interactions. Join community groups or volunteer. Stimulate your brain. Cognitive engagement builds resilience and neural connections. Learn new skills. Play strategy games. Read, write, or engage in creative activities. Holistic and culturally responsive adaptations. Given your work in participatory design and culturally distinct communities, these strategies can be adapted into community toolkits with culturally relevant examples. Traditional dance as exercise, digital outreach campaigns that promote sleep hygiene or food literacy, frailty-aware screening protocols that integrate social and cognitive risk factors. Would you like to co-design a framework or resource that integrates these strategies into your caregiver support or aging interventions? I can help tailor it for diverse urban populations. Social interaction plays a profound role in maintaining and enhancing cognitive health. especially as we age. Here is a synthesis of what the latest neuroscience and public health research reveals. How social interaction supports cognitive health, benefits, mechanisms, and impact. Okay, enhances cognitive reserve, engaging in conversations that shape activities and shared activities, stimulates neural circuits that promotes neuroplasticity, helps delay onset of dementia, and supports memory, attention, and executive function. 2. Reduces stress and inflammation. Socializing lowers cholesterol levels and buffers against chronic stress, which can damage brain cells. Protects against hippocampal shrinkage and cognitive decline. Combats depression and loneliness. Meaningful relationships foster emotional well-being and a sense of purpose. Reduces risk of depression, which is a known risk for risk factor for dementia. Give me 1 second, guys. Okay. Promotes brain flexibility. Dynamic social interactions challenge the brain to adapt and interpret cues and respond appropriately. Supports mental agility and resilience across the lifespan. Encourages healthy behavior. Social networks often reinforce positive habits like exercise, diet, and medical adherence. Indirectly boost cognitive health through lifestyle supports. Increases risk of cognitive impairment. Risks of social isolation. Increases risk of cognitive impairment, depression, and early mortality. Higher levels of inflammatory markers and vascular risk. Reduces access to health information and support systems. Implications for community-based care. Given your focus on culturally responsive and participatory models, social connections can be a core matrix in frailty-aware assessments, a design principle in caregiver and senior outreach, e.g., integrational programs, peer networks. Next page. A proactive factor in digital harm reduction and dementia prevention campaigns. Would you like to co-develop a framework that integrates social connection into your cognitive health interventions or caregiver toolkits? I can help tailor it to diverse urban or aging populations. Pollution or specific cultural contexts. There are many innovative and effective programs designed to promote social interaction among seniors, helping to combat isolation and support cognitive and emotional well-being. Here is a curated overview based on recent examples and best practices. Okay. Effective programs that promote social interaction for seniors. Program type, description, and benefits. Community centers and clubs offer structured activities like fitness classes, arts and crafts, educational seminars, and social gatherings. Build, builds routine, fosters friendships, and engages physical and mental engagement. Integrational programs connect seniors with youth, uh, youth thorough share those shared projects through shared projects. Storytelling or mentorship promotes purpose, reduces ageism, and enhances cognitive stimulation. Volunteer opportunities. Senior, Seniors contribute to community causes such as tutoring, gardening, or food distribution. Boosts self worth, social ties, and mental health. Community gardens. Seniors collaborate to grow produce and flowers in shared spaces, encourages teamwork, outdoor activity, and sensory engagement. Cooking and dance classes, group based learning that blends creativity, movement, and social bonding, enhances cognitive accuracy and physical health while reducing loneliness. Group exercises, water aerobics, low impact fitness tailored to older adults, often held in community pools or centers. Involves and improves mobility, cardiovascular health, and social connection. Lifelong learning, tech works, tech workshops, classes on new subject or digital tools, sometimes with family participation via video. Calls stimulates mental engagement and bridges generational gaps. Timed themed dinner parties, game nights, regular social events that engage laughter, storytelling, and camaraderie, builds community spirit and emotional resilience. Okay, guys, so that is it for today. I will see everybody Monday for shows. For now, Gator Wellness. Take care, folks.